And now I'm talking to Paula Leonard, the National Lead for Community Action on Alcohol from the Alcohol Forum. Paula, welcome to the programme.
Hello, how are you?
I'm fine, thanks, Paula. Paula, the main reason we are talking today is for our listeners to find out about the seminars held on alcohol justice and the SDGs recently. Before we talk about that, could you give me a summary of who the Alcohol Forum are and tell me a bit about the kind of work you do throughout the year, please?
Absolutely. The Alcohol Forum is a small charity that's based in the Northwest. It was set up just over 10 years ago out of a concern across agencies here relating to the number of children that have been referred to Child Protection Services as a result of sort of parental alcohol misuse. So from that initial gathering of agencies and groups and organisations, there emerged our organisation, which is based here, headquartered in Letterkenny in County Donegal, but we work locally and regionally, and then at a national level we work on a number of projects, including community action on alcohol, and we support communities with in partnership with drug and alcohol task forces to develop community action plans to reduce alcohol harm. We have a whole range of projects here, including the only specialist rehabilitation service for people with alcohol-related brain injury. Unfortunately, the age profile of people presenting with an alcohol-related brain injury is getting younger and the numbers are getting bigger. And we would also deliver family support initiatives and drugs and alcohol education prevention work. So that's sort of us in a nutshell, if that gives you a little flavour of the work. So we deliver direct supports and services, but we also work at that wider policy level, looking for positive change in relation to alcohol harm.
Okay, that's great. And he's based in Letterkenny. I love Donegal. It's probably my favourite county, you know.
Me too. I'm a Mayo woman who moved here.
Oh, cool. Yeah. You are, I presume, in the Alcohol Forum, big supporters of the Public Health Alcohol Bill becoming enacted, are you?
We absolutely are. And I suppose my own particular role around that, while our organisation and our board and our staff fully support the bill and have been very actively, campaigning for the bill, our particular role around the Public Health Alcohol Bill has been supporting communities themselves to make their support for the bill visible. Because one of the big sort of myths out there among, politicians and the elected representatives is that there isn't huge support for the bill at the grassroots. And there's been this notion that the bill is something that's quite nanny statist and that it's about, certain groups and organisations legislating for people's choices and to limit people's choices and the availability of alcohol. And really, when you go out around the country, we have 21 communities now where there are community action alcohol plans. People are really clear that, when it comes to alcohol harm, they've seen enough, they've had enough, in terms of young people struggling with the amount of alcohol advertising that's out there, the levels of drinking among young people, the amount of alcohol harm in families, all of those things. People really have seen enough and had enough, and they're ready for change. And they're clearly saying to their, elected representatives at the local level and at the national level, we're supporting the bill. So while other, specialist health services and things, I'm thinking particularly in terms of liver and the cancer care people and all of those, they've done a great job at the higher policy level. Our role has really been about the grassroots and people knocking on the doors of the local politicians and saying, do you know what, we want to see this bill passed because it really matters to us and it's going to make a difference to communities.
These local plans, are any of them in Dublin, do you know?
There are several in Dublin.
Oh, right.
We are working in Canal communities in Dublin 12. We have 3 towns in North Dublin with the Regional Drug Task Force in North Dublin, so Skerry, Swords, Balbriggan. We also then, there's ones in Kildare as well, and there's ones in Clondalkin and Tala.
Okay. About the Public Health Alcohol Bill again. How long this bill has dragged on for is very disappointing, isn't it? I think
yeah,
it is.
Extremely. Yeah. And at the moment, we've had the EU Commission has really enforced the 3-month standstill at the moment because the Commission have had to re-notify the government, and they've said, look, we want to have a look at this. And the Commission has made comments. The Irish proposals have seen some sort of negative commentary and stuff here in the Irish papers. But basically, at the moment, there's another delay. This time, it's been at an EU level rather than at a national level. And I think it's really important that at this time, that, groups and organisations beyond alcohol, people working with young people working with children, people working on a whole range of issues, including mental health, because we know that, 50% of suicides have alcohol as a factor. 1 in 3 incidents of self-harm in this country have alcohol as a factor. So it's really important that a whole broad range of groups and organisations start to get active and show their support for the bill at this critical stage, because it's lingered for long enough. It sort of moved between the different houses of the Oireachtas, and the heads of the bill were published back in 2015. So it's time, and I mean what the Department of Health and what Minister Byrne repeatedly say is that they're committed to the bill and that there will be a bill. And our key question right now is when. Because there are other political considerations. If the government was to fall, what does that do? Do we then face further delays? There's a whole series of things, but right now what we're saying is not only do we want the bill, but we want the bill as soon as possible.
Yeah, the last I heard of a timescale, I think it was Catherine Byrne, is that her name, the Minister for Drugs? Mm-hmm. She said about 2 or 3 months ago she was hopeful that it'd be enacted before the end of the Dáil summer break in July, I think it is. Is that time frame still realistic, or will it be longer than that, do you think?
Well, it's very difficult to know, because the European Commission's, that process closed on the 20th of April, and 7 member states made comment, and 2 member states have submitted quite detailed opinion in relation to opposition to parts of the bill around the laws of competition. So those submissions mean that there now will be another period of review that will conclude on the 20th of July. So if that only concludes at the EU Commission level at the 20th of July, it's very doubtful that anything then would happen before the summer recess in Leinster House.
Yeah, I think it's disgraceful the way some other countries and the European Commission are sticking their oar in, you know what I mean?
Yeah. But I mean, let's look at this from a different point of view. The global alcohol industry is a huge industry, really well resourced. The most recent estimate from Euromonitor in 2016 is that they're worth $1.45 trillion. And they have been very active opposing progressive legislation across countries. It took Scotland 6 years from when they agreed minimum unit price for alcohol. It took them 6 years, and they had to fight that in the Scottish courts, in the British courts in London, and in the European courts. And on the 1st of May this year, they finally saw the introduction of minimum unit pricing. And minimum unit pricing, I suppose, for your listeners, what does that mean? That means is that, alcohol can't be sold below a certain price. And that will save lives, because it will mean that problem drinkers and young people will drink less. Particularly, they're the 2 groups that we know will be most impacted by minimum unit pricing. So minimum unit pricing will save lives. It did take them a long time. They were very committed. They were very clear that they weren't going to negotiate with the alcohol industry or interests within the alcohol industry. And they fought it through the courts, and their government supported that all the way. It took a long time, but they've got there. And that sets the scene now for, the likes of more progressive measures in our bill, including minimum unit pricing.
Yeah. Okay, if we just move on to the seminar you had in Dublin recently, can you tell me what was the purpose of the seminar and what good came out of it?
Well, the seminar really came out of, in a way, looking at broader social justice issues and equality issues as they relate to alcohol. And that's not something we've done in Ireland in any big way to date. We talk about alcohol as a really important social issue and as a really important health issue, which it is, and it absolutely is. But we haven't particularly looked at things like alcohol being a cause of poverty. We haven't looked at, alcohol being a cause of... There's a causal relationship, say, between the HIV/AIDS epidemic internationally and alcohol. alcohol being one of the key risk factors internationally it's 1 in 4 of the main risk factors for non-communicable diseases. So you're talking about liver, you're talking about cardiovascular health, you're talking about all of those. So we now have, Agenda 2030, which has all governments have signed up to a range of sustainable development goals. And they run from everything like looking at your water footprint, looking at, environment, looking at people. They have 3 sort of themes, which are people, planet and prosperity. And what our seminar was basically about was, well, let's look at the big picture. Let's take a step back from the lens that we've been looking at alcohol through, and let's look at the big picture globally and then within Ireland. How is alcohol a barrier to the achievement, say, for example, of women's equality, of poverty, eradication of all of those things? So it was a really interesting discussion. And I suppose as the organiser of the seminar here in the Alcohol Forum, I contacted IOGT, which is an international organisation that works on these issues across 50 countries, most lower income and middle income countries. And they were really interested because they were delighted that Ireland was finally sort of looking at alcohol in this way. They contacted the United Nations. The United Nations equally were really interested that Ireland was beginning to look at this issue in this way. The United Nations then sent a health and development policy specialist who was one of our speakers on the day. And I suppose from my own learning, the most interesting thing for me on the day was he was saying from a financial point of view, the work that the United Nations is now doing across countries is that it has become increasingly obvious to them that if you want to achieve progress in a number of key areas, including poverty, women's equality and sustainable development, your best bet in terms of spending money is to tackle alcohol. Because if you can tackle alcohol harm, you will have benefits in those other areas, which is a really interesting analysis, and it applies to Ireland as much as it does to lower and middle income countries around the globe.
Yeah, Irish people, we have a reputation around the world for being drinkers, you know what I mean? So are you saying in other countries across the world, you probably get exceptions maybe, but in other countries across the world, it's actually the same kind of levels of problem?
No, I think everywhere, what we know, the Irish we're pretty high on the league table in terms of drinking, but we're not top of it. We actually drink relatively infrequently. But when we do drink, we are big bingers, and we are top, we're right up at the top in terms of the international tables around binge drinking. We do have a problematic relationship with alcohol, but we also are Europeans, and Europe has 15% of the world's population, but it consumes 25% of the world's alcohol. So we're not just Irish, we're also European, and European is the heaviest drinking region on the globe. The concern of the United Nations and the World Health Organization is very clearly that the alcohol industry now sees that, they have achieved big markets, big profits in Europe, and they're now moving their attention to the developing world. And that's a big issue for them in the United Nations and the World Health Organization, because we're seeing aggressive marketing of alcohol in those areas. We're seeing, really low-priced alcohol being sold to quite young people in a very aggressive way to get people drinking early and then to hold them as drinkers. And you're talking about this expansion project of the industry in a context where a lot of those countries would have very poorly developed health systems. They'd have very poor services in terms of dealing with, the fallout from alcohol harm in terms of therapeutic interventions and medical interventions. So, in a way, when they were talking, one of the audiences that we had for the seminar was the development and aid organisations based here in Ireland. And for them to start to think about, well, what does it mean in terms of the work that we're doing across Africa and across Asia? What does alcohol mean? And, how do we get it on the agenda of those agencies? And that was part of the conversation on the day, which was quite an interesting discussion.
Yeah, it's very interesting listening to you there about developing countries. Just another question on the seminar. You're saying there that the UN said it was UNDP, was it?
Yeah, the United Nations Development Programme,
Yeah, they were saying, you were saying there a minute ago that they were saying that if you want kind of to save money, go after alcohol policy. Like, how, in an Irish context, how does kind of that help achieve the SDGs? Can you tell me?
Well, I mean, if you look at, say, within the Sustainable Development Goals, you know, under goal number 3, there is to reduce the harm from alcohol and other substances. So that's just a very clear one. And the Irish government actually have been pretty progressive in terms of what they've put in as their targets in the Sustainable Development Plan. They've clearly said they want to see the enactment of the Public Health Alcohol Bill. They've also said that they'd like to see a reduction you know, by 2020, they've set the goal that we'd come down from a consumption level right now that's about 11.5 litres per adult per annum, that we'd come down to about 9, which is the OECD average. So that's quite an ambitious goal, and I mean, the Irish government has to be commended on that, and I think in a way that reflects the fact that there is still some commitment to the Public Health Alcohol Bill. But then across a range of other areas, so say, for example, we have targets in relation to a reduction in violence against women. We have targets in relation to health and well-being. And alcohol is a serious issue and a factor that we need to look at in terms of its impact on women's equality, issues including violence against women and children. We also need to look at, you know, the role that alcohol plays in maintaining poverty in certain households in Ireland, where household income has been spent on alcohol rather than other essential areas. We have, say, estimated 170,000 people roughly in Ireland are estimated to be dependent on alcohol. You know, what supports are we putting in place for those individuals and then their families around them? So the SDGs is an interesting way to look at it, because if we make progress on alcohol, we'll start to make progress on other areas, including, you know, mental health and well-being.
This last question, I had to follow up on something you said there a few minutes ago. How does alcohol, I think I know the answer to this, but like alcohol and the increased risk of contracting HIV or STDs, you mean when people are drunk, they're kind of more likely to engage in these kind of activities?
Well, yeah, I mean, there's no one cause in relation to that piece, and it's quite complicated in terms of the research that's emerging. But some of the things that would be being talked about and pointed to in the research at the moment is that, you know, people who are abusing alcohol are less likely to maintain adherence to their drug treatment. You know, they may miss appointments, they may not follow how frequently they're supposed to be taking their drugs. They may also have, we talk about a causal relationship, you're absolutely right, in terms of alcohol consumption and sexual activity, risky sexual activity. So this is something that we need to start to talk about and think about, and it's as relevant in Ireland as it is right across the globe. And, you know, when you talk, like this afternoon, we have the first steering group meeting of Community Action on Alcohol in Letterkenny, and one of the first people that has come forward and said they're really interested in being involved in that is the forensic person from the Sexual Assault and Treatment Unit, because she's saying, look, alcohol is a key driver in terms of risky sexual behaviour, particularly among young people. And we would know from sort of research that came out from sort of Safe Ireland a number of years ago that 73%, I think, of perpetrators were found in one study. Perpetrators in terms of sexual violence were shown to have had alcohol in their system at the time of the assault. This is a difficult conversation to have, because alcohol absolutely is not the cause of physical and sexual violence. You know, women's inequality, power and control are the causes, but it is an incendiary device. It is something that facilitates violence on any given night in any given situation. I suppose for us, the most important part of the seminar is what's next. When the United Nations Development Programme were here in Ireland, they also met with the Department of Health and with the Department of Foreign Affairs, with Irish Aid. So they had a series of meetings when they were in Ireland, including the seminar, and the Alcohol Forum was delighted to be able to facilitate those with the different government departments. And really for us, there is talk at the moment about it becoming a national, yearly event while we are on our way towards achieving the Sustainable Development Goals. For us, it was a really new thing. People kind of didn't get it. The people who are currently involved in sustainability or SDG work, they were like, we're not really sure where alcohol fits in. So this was the opening of a conversation. So rather than it being an end in itself, I kind of think it's what do we do now that we've listened to those experts, now that we've all learned a little more than we knew before. What do we do now? How do we ensure that alcohol gets priority within the SDG conversations, and that people are supported to understand the crucial roles that alcohol plays as a barrier to the achievement of the SDGs.
Okay, that's great, Paula. It's very interesting listening to you there about your seminar from an international context in the SDGs. I've done several interviews over the last few years on radio on the Public Health Alcohol Bill, including a couple of interviews with Alcohol Action Ireland. I know at the start of the interview you explained for a few minutes that you do a lot of your work is in the community on a national level. Is that the main difference between yourselves and Alcohol Action Ireland? And can you tell me of some other organisations or resources our listeners can check out on the issue of alcohol abuse and alcohol justice?
Yeah, I suppose just in relation to our work, we are very much a grassroots community-driven organisation, and that's really important. We deliver supports and services at the grassroots and, in the frontline communities. And then we provide support to new communities to develop action plans and to get active on the issue. So we really see ourselves as that sort of grassroots piece, but we keep an eye on policy. We look at how communities can support and look for progressive policy change. And, there are others like the Public Health Alcohol Alliance, which is a network of groups that we're aligned to. There is Alcohol Action Ireland, that's a policy-driven organisation that does a great job at sort of those higher levels, negotiating with the elected representatives and supporting the Public Health Alcohol Bill and other policy measures. But really right now in Ireland, if you want to know more about alcohol, in terms of your own consumption or your concerns in relation to health and well-being, or your concerns around how you might get referred to services, there's one go-to place, and that's the Ask About Alcohol website that's run by and has been developed by the HSE Alcohol Programme. So it's just www.askaboutalcohol.ie, and it really is a comprehensive and evidence-based resource. And I think it's really important to say that, it has been published and it is managed by the HSE, who don't collaborate with and don't take funding from the alcohol industry, because a lot of the other resources that are out there have been funded and developed by the alcohol industry. So it's important that people know that, and that when you're looking for impartial advice, www.askaboutalcohol is where to go.